Hey everybody, JCB here at the Awesomist, and you're watching the Awesomist YouTube channel. For those of you who don't know, I am married to a beautiful woman who fans have taken to calling the Awesomist. She's my best friend and the most amazing person I've ever known. The Awesomist has worn contact lenses for many, many years, and she's also worn glasses whenever she just didn't want to deal with her contacts. My point is, since I've met her, her eyes have been pretty bad. She's naturally nearsighted, the technical term for which is myopia, and she typically can't see anything beyond 12 to 24 inches from her face without the help of glasses or contacts. I love the way my wife looks in glasses, but she hates the way the lenses smudge up. She hates how they get uncomfortable and how she's essentially blind first thing in the morning when she wakes up. Her contact lenses present their own set of problems, including the constant need to clean and change them, the fact that they're expensive, and they often dry out at the worst possible time. There was a period where every time we went to Six Flags Magic Mountain, my wife's contact lenses would start acting up, and we'd have to visit the first aid office just to use their contact lens solution. Unfortunately, for the vast majority of people, a time will come when a condition called presbyopia kicks in, which is what necessitates the need for older people to wear multifocal lenses, such as bifocals or progressives. If you're naturally farsighted, this is no big deal. You basically could just buy reading glasses when you want to read, and the other 80% of the day you're fine just wearing nothing at all. But if you're nearsighted like my wife, 80% of the day requires the need of some kind of glasses to see anything out there. Otherwise, you buy multifocal lenses like bifocals or progressives, but I know my wife, and if a small smudge annoys her, having a line on the lens at all times, or specific regions of a lens that are unusable, is going to drive her, and by extension me, absolutely insane. And multifocal contact lenses weren't exactly a solution for her either, as she's very particular about the comfort of her eyes. She has special eyes.
I have special eyes.
Look with your special eyes.
My brain!
So every time the subject would come up, I would mention that Lasik was an option and that we should look into it. Well, she finally broke down and got it, and I documented the whole process. If you're grossed out by talk and imagery of eye surgery, you should probably stop this video now, or if the visuals are the only thing that bother you, you can switch to a different tab the next time you see this kind of warning. So the process starts with a visit to your regular eye doctor, who will tell you if they think you're a good candidate for LASIK surgery and usually suggest a LASIK center for you to go for your free consultation. My wife went to Envision because her optometrist highly recommended them, and he actually sits on the board. At this consultation, they'll do a very basic eye exam and basically tell you if you're a good candidate or not for LASIK. This is a great time for you to get any questions you might have answered. They'll also tell you about the price and all the different procedures and stuff that go along with it, and they'll also schedule your pre-op and post-op appointments for the days before and after your surgery. About 2 weeks before your visit, you'll have to stop wearing any contact lenses, and you'll begin using eye drops and vitamins that come in a starter kit the LASIK center will sell you. There are also medicated eye drops that are to be administered the day leading up to surgery. Within the week before your surgery, you'll return to your optometrist, and they will do one final check to make sure your eye is in good shape and to get the final readings for the following visits after surgery to use as a comparison. During this visit, they will dilate your eyes, so make sure you have a driver and some dark sunglasses. By the way, all of these pre-op and post-op visits are covered under the cost of the surgery. The night before my wife's surgery, she was incredibly nervous and was kind of half-heartedly trying to get out of going the next day. The Envision LASIK Center was about an hour and a half from us, so we woke up at 4 a.m. to make sure we had time for some food before her 6 a.m. surgery. So, tell everybody where we're heading today, love.
Starbucks.
Tell everybody where we're heading after we get breakfast.
Home.
No.
We're going to go to Envision in Ontario, and they're going to give me a flap.
Yes.
2 of them.
Uh-huh. Are you nervous?
I'm nervous that I'm going to disrupt the flap.
Are you excited about getting rid of your glasses?
Yes.
What's your least favorite part about having glasses?
Smudges.
What is your hope for post-surgery today?
Turn right.
That I don't
then turn
dislodge
left.
my flap.
Unlike other surgeries, they actually recommend that you eat before you come in, as you're expected to be at the LASIK center for right about 3 hours, although you are asked to avoid any kind of caffeine, as you're expected to sleep for the remainder of the day. When we arrived, we signed in and they started asking her some basic questions, and then we had to wait. Can you read what it says on that pamphlet across the way by the plan? At the very top, without your glasses on.
inside.
Yeah, good.
But no, I can't.
After a bit of waiting, they took my wife back to the exam room to do some tests and ask some questions, which I actually wasn't allowed to go with her to experience. In fact, I had to wait with our daughter in the lobby until they were ready for us to come watch the procedure. So since I wasn't there, I'm gonna go ahead and let my wife explain what happened in that time period.
So when they called my name, I went back by myself because they stopped Josh and my daughter. And then they took me back to the examination room, and it was I think 1 or 2 quick little eye exams. And then they took me back to a room by myself. And while I was back there, the lady proceeded to tell me that it was going to be 2 to 4 hour process. And the hardest part would be waiting alone. And that wasn't what we were prepared for, because they said that it would be a 2 to 3 hour process, more likely to be 2 hours, and that I could have my family members with me. So that made me kind of upset. And then the lady left the room, and I tried not to cry because it was just a big thing, and then I was all by myself all of a sudden, and I was not prepared for that whatsoever. So then a really chipper nurse lady, I believe she was a doctor, she came in and she was really nice and she was calming, and she said, okay, so it'll just be a few more minutes and then we'll take you back. And then I think she looked at my eyes or my scans or something like that, and then they took me back to the prep room where the nurse gives you the medication and then gives you the drops. And then 2 other ladies came as well, and they were there for surgery. So the process wasn't actually that long. I think it was maybe an hour before my husband and my daughter could come back. And it was just more daunting when I was by myself than it was when they ended up being able to come back, or even be around somebody else, because you're just sitting in the room waiting and there's like a big surgery gonna happen. So that was really nerve-wracking.
And then it was time for the actual surgery. The most basic explanation of LASIK surgery is that it basically just smooths out the surface of your eye. You see, the surface of your eye is naturally kind of bumpy with peaks and valleys. And the idea is the laser actually flattens out those peaks and valleys so that light can actually focus on your retina instead of stopping just before or just after, which is what causes blurry vision. Now, because she was inside of a sterile operating room and I was outside in the observation room, the footage you're about to see is the live feed they broadcast to the TVs overhead. My beautiful wife has not yet seen the footage I'm about to show you. It's been about 2 weeks and her vision's fine. In fact, she can see perfectly. She just kind of refused to watch this footage ever since. There is also no audio. I couldn't hear the surgeon speaking or anything like that from where I was standing. The only audio my camera recorded was the other people in the observation room talking. So I cut it out in favor of including my wife's real life, genuine reaction as she views this footage for the very first time. This is where things get a little gory. You're going to see the surgeon cut open the top layer of the eye, fold open the flap, and then shoot it with the laser. Immediately after filming my wife's reaction, she asked me to strongly suggest that you do not watch this video if you are about to have LASIK surgery because it will freak you out. She stated that nothing can convince her to have LASIK if she had watched this video ahead of time. Having gone through the procedure, she has no regrets and would in fact regret not doing it, but the footage you're about to see might scare you into dealing with glasses for the rest of your life. There is of course no blood or anything too gory. There's nothing really gross if you ask me. In fact, I think some of those pimple popping videos on YouTube are far worse. However, if you are grossed out by this kind of stuff, you do have 3 options. 1, you can skip to this time code, which will resume right after the footage is done showing. 2, you can open a secondary tab and just listen to this video while you read other articles or visit other websites or what have you. Or 3, you can turn this video off right here and never visit it ever again. You have until the end of this countdown to decide what you're going to do.
Oh my god, I hate it already. I hate it already. Oh, I hate it. Oh my god. So he just put like the drops, the cleaning drops in my eye. He already put the little thingy-dingy in my eye to keep it open. Oh, right here, they tell you you're gonna lose your vision for a second. So you completely 100% see black. Well, you don't see anything. So it's completely black for this moment. And it was kind of scary, but not, because you're still kind of calm, probably from the Xanax, but I don't know. But when they first press that thing down, it's like you completely cannot see. And then they're like, oh, stare at this beautiful green light. And it looks like if you were to put your face inside of a stoplight with the light green. And there's also some red lights going on and going around. I don't know exactly what's happening. Like why it's going. Ugh, what is he doing? So unnerving. Oh my god. I hate it. Ooh, what's that? Why has it got lines on it? I hate it. God, I hate it. This is stare at the green light thing again, too. Oh, yeah, this felt like a squeegee. Okay, so I asked him if he ever had... Oh, God. If he ever had it compared to a car wash for your eyeball. He said no. Oh no, no. Oh god, no. Oh god, no. I don't want to watch it. I would. No. Oh my god. I was better off not knowing. Oh my god, thank god Oh no! Why? Oh, it's horrific. No one should watch this. Oh my god, it's disgusting. I want to kind of throw up. Oh, stare at the green light more. This is so much more better when you're not actually watching this, because you don't see any of this. Okay, so I think they just lasered it, and it smelled like burning hair, and like you could see a little puff of smoke. Oh god, why is that horrific? That is horrific. Huh. This is making me sick. I feel a little genuine. God. I feel so sick. It's so gross. Oh my god, thank god you don't see this when this is happening. It's horrible. This is awful. Anyone getting this should never watch this. Maybe when it's done. Maybe like now, but anyway. So I asked him if he ever had... I can't even talk. If he had ever had this compared to a car wash, like cleaning windows. Like this is like a car wash for your eyeballs. And the squeegee that goes across, it makes it clearer and clearer as you are looking up, which is kind of really cool. God, this is disgusting and scary. I don't know what any of this is. Like, I remember lights and stuff like that, but... And the squeegee thing. My stomach hurts so bad I want to vomit. So gross. My friends definitely cannot watch this if they're gonna get it. I have to warn people now. That's awful. You don't ever want to do this if you look. I would never have done it. I wouldn't have done it. I would have said no. Not happening. Not doing it. I think he's gonna do the squeegee thing again too. Nope. A little eye clampy out. Ugh, gross. Nasty. Oh, that was all upside down too. Oh, gross. No wonder they talk about the flap. Oh my god.
As I said, the procedure was a complete success. They gave my wife a Xanax right before the procedure, which is common practice to ensure the patient stays calm. They also gave her one to take home to help her sleep for the rest of the day. But because I knew we had an hour drive home, I decided to ask her some questions as soon as we got into the car before the medicine fully kicked in. What happened once you got into the actual surgery room?
So then they walked me into Dr. Prisnazar, and then he sat down and he was very cheerful and nice. And
he had me look at the light. Well, look at his ear while he looked at the light that went around each eye. Then he said, I'm perfect for surgery. My numbers look great. This will be wonderful. Don't be nervous. And I said, okay. Then he told me about lay down on the bed, and the bed has a donut for your head. And I told him I like donuts, so that works.
How much Xanax did they give you before the surgery?
I said 1.0.
Okay.
Why?
I like donuts. You sound like you're high.
Oh, I was trying to make a joke so I could relax.
Oh, gotcha.
Because he was nice.
Yeah.
Plus, I figured, how many cool things could I say to him that maybe he's never heard? I thought that would be fun. So then they lay me down, tell me to close my eyes so my eyes don't dry out, pull me back. I could see the lights through the eyelid, of course. And then, I don't know if the woman said it or him, but they were going to cover my left eye, and they started with my right eye. And then he said to look up at him, and they put tape, and then they put tape. And then it looked like a metal retractor for your eyelid. I thought that was going to hurt real bad, or be big white in four corners and what you see in the movies. That scared the crap out of me. Prior to seeing what it was, and I was like, oh great, how's this gonna feel? It just felt like a little snug pressure. Okay. It wasn't that bad.
Wasn't cold or anything?
On the right eye. Not necessarily.
Okay.
I
think
I
you
wasn't
could see
thinking
metal.
cold. It was kind of cold in there no matter what,
Oh,
so
okay.
it didn't matter. But I think my eye and the eyelid was slightly numb. Because I could still feel stuff on my eyelid and a little bit of pressure. Then he told me to stare at the green light, and then there's also red lights and white lights, and the green light is in the center. So then I stared at the green light, and then he pulled this thing over and he said, there's going to be slight pressure and you're going to lose all vision for a moment. And I thought, that's great. Said, okay. And then he pulled it over, he's like, look at the green light, and then the green light's there, and then it starts to get super blurry, so it just looks like a bunch of pixels, and then gone, black, nothing. You see nothing at all. And he pulls it away, and then everything's kind of blurred, just slightly, like a slight film, like maybe somebody put chapstick on your window, something like that. And everything that I was relating to through this whole process are windows. Okay. Just to be clear. Yeah. We're car wash and windows is where I'm going with everything. So then it's look at the light. I feel like it was a metal scalpel by my vision, not by the actual feeling. Okay. Not the sensation. Don't have a clue what tool he was using. Makes like a circle around you, and then they do a thing, and then they wipe over and thing, and stare at the light. And then there's this burny smell, and then zzz, which obviously it's got to be a laser, right? Yeah. I was not fully prepared for the burny smell, but it just smelled like burning hair, like you just singed your arm on the stove or something.
Did you see any purple lights at all?
No purple.
Okay.
Just red, and the red changed to kind of orange-y because when it gets smushed and blurry. Okay. And then he had like this other plastic tool, and he was like situating things, and you could see your vision just going like this a little bit. And then there was like a plastic wipey tool. It looked flat, and it looked like he was...
A little squeegee.
I felt like he was cleaning my eyeball as if it were a windshield.
I'm pretty sure he was making sure the flap was sealed correctly.
I felt like, okay, he's trying to get all the air bubbles out.
Yeah, basically.
Is what I felt. So like if you were to put a skin on your phone, that's also a screen on you.
Yeah, the protective screen on your phone.
That's how I felt. And then he's like, good, that eye's done. Now the next eye. And as he was wiping, vision was getting clearer and clearer and clearer. And then there's just a slight glare. Like again, like there's chapstick across a window or something. Yeah. Just slight, not so blurry, just filmy. Oh, like when you get a new phone and you peel off the screen, or like the watches. You're like, oh, this watch isn't as clear as I thought it was. And then you're like, duh, I didn't pull the screen film off because I'm smart. Kind of like that. So exact same thing, left eye, more pressure. I wouldn't say pain, but it was a lot more discomfort on the left eye. Okay. My left eye is worse, so I don't know if it had to do with that. I got slightly scared when he was all, look at the green light, and I saw it for like down towards the bottom, of the thing is what it felt like to me, and then it was gone, and he's like, look at the green light, and I'm like, there's the green light. I didn't say anything because I'm nervous.
Oh my goodness.
But I tried. And he said everything went great, that's perfect, and then as he's getting rid of me, or not rid of me, but like
Smoothing
pulling
you
me
out?
back out,
Oh,
yeah. I said, has anyone ever compared this surgery to a car wash or like washing windows? And they laughed, all of them. And they said no, and I said good, because that's what I feel like. It was just like a car wash. I feel like I got my windshield cleaned. And he laughed a little bit more, and I said thank you, and he helped me up, and he's just very, very nice person.
Did he give any kind of timeline on when your vision will stop looking hazy?
Next 24 hours, I should just be sleeping the whole time, so I'm not allowed to look at anything. I'm not allowed to read, text, watch TV. I should sleep for the next 6 hours for sure. Tomorrow it should be clearer and doing well, but they can just hope for the best is on everything. And we'll see at our doctors or our optometrist how it's going, and then it should clear up every day. Should get better.
Nice.
Yeah. So I'm supposed to have a follow-up tomorrow and a follow-up in a week. Then the paper in the folder tells me what dates I need to have a checkup. And he said everything should go good. As the numbing drops wear off, it should feel slightly stingy and itchy. No drops today at all whatsoever, just the sleepies. And then tomorrow, full regime of drops and everything like normal. And if it's too stingy or too itchy or irritating, I'm supposed to take normal ibuprofen, Advil.
Yeah.
Tylenol.
Over-the-counter stuff.
Anything like that, yes, and just try to keep my eyes closed most of the time.
Cool. What was the scariest part for you?
Waiting all alone. Hearing the lady say this procedure is going to be 2 to 4 hours, and most of it's going to be the wait time, and thinking I'm going to be alone this whole time really sucked.
Yeah.
Then they left me in the waiting room with the soft squishy chairs. I liked those. But I had a small amount of time of alone, and I didn't like it. And I started going, okay, think about everything else. So I looked at the medicine cup that she gave me, and I was looking at the details on the medicine cup. Then I went back to my socks because I really like them. They make me happy.
So the whole thing took a little bit less than 2 hours.
Yeah. They said in the morning they go very quickly, but when she said 4 hours, 2 hours I would have been okay with. She said 2 to 4. Go ahead and text them and let them know they'll be waiting a while.
And your brain went straight to 4.
And I said, I don't have my phone. Would you like us to tell them, is what she asked me? And I'm like, yes. You make me weak, just so you know.
I make you weak? Oh my
weak.
God.
I'm a very strong person, and damn it, you make me weak, and I don't appreciate it.
Is that a compliment?
Maybe.
Or are you saying I spoiled you?
Maybe both. Because if I were alone, if it were me, and I was alone and being me when I was alone, I would just be like, well, yeah, I got to get this shit done, so I'm gonna sit here and wait, and it's whatever. But now I'm thinking, you're out there and I'm in here, and why can't you be in here? And I don't like being weak.
Aww.
So I'm a little mad at you right now.
Alright, my phone's burning my hand up, so I'm going to turn off the recording.
You can do what you want.
Okay. So obviously she was a little fuzzy there. We didn't have a whole lot of time to ask questions before our long drive home, so I decided to go ahead and ask her some questions now on camera. Since it's been just over 2 weeks, she's had some time to actually absorb everything that's happened and experience the healing process firsthand.
The day of surgery. The dilation was just a lot of too much light in my eyes, and everything was super sensitive, and it only lasted maybe, well, it was pretty much a full work day, because by the time you got home I had just gotten better. So the day of surgery, the surgical part didn't hurt at all. Directly after surgery didn't hurt at all. I had an hour drive between surgery and getting home, and I started to feel uncomfortable in the car because of how bright the light was. So I put a scarf around my head, plus they had given me sunglasses, but that didn't really help that much because it's California and the blazing sun. But then when we got home, I fell asleep a little bit in the car and my eyes were super swollen. I assumed that they were swollen shut. I couldn't open them. Joshua walked me into a washing machine. He walked me into a doorway. He walked me into a doorway. He walked me into a wall, a doorway, and a basket. And then I got into the bed. And that was probably the most uncomfortable I was. Then they gave me medicine and I slept for another 6 hours and I woke up and I could open my eyes. And I couldn't keep them open for very long. They were just very itchy, but I had the shield on so I couldn't scratch or rub or anything like that, so that was helpful, but that was probably the most uncomfortable I'd ever been. Don't watch this video. Maybe have the person that's gonna pick you up, drop you off, be with you, watch the video, but you don't watch this video. I watched the video and don't watch this video. Just don't. Other than that, make sure you follow all the instructions. Take the medicine, do the drops. I think doing the drops, one, prepares your eyes, but also prepares you for how many times you're gonna have to do drops. Definitely wear very comfortable clothes that you're gonna go to the doctors in, because immediately when you get home you just want to go to sleep. So something you don't necessarily want to change out of, especially if your eyes are swollen and you can't open them. Those would be the main things. The very next day we went to do the checkup and I talked to my doctor and he asked me how everything went there. Everything went fast. Healing went fast, I would say. It felt like eyelash was stuck in my eye, or like itchy, or just blink a lot. I would put the drops in 4 times a day like they said, or more. It was just felt swollen, but not too bad in discomfort. Not something that you wouldn't be able to handle or that doesn't just get over it. I think within 3 days, the left eye was still feeling a little bit itchy, like I had scratched it or something, and when I was blinking, I could feel the little bit of sting. But after, I think my week checkup, I felt good. I didn't have any discomfort whatsoever. Now it's been 2-3 weeks and I don't have any discomfort other than light sensitivity. Beginning from day one, very light sensitive, and I wasn't before, and I rarely wear sunglasses, but now I wear them all the time. None whatsoever. When they first start the procedure, they give you the numbing drops, they give you the Xanax, they do the eye spreader, so that keeps your eyelid open and you don't feel the need to blink. They isolate your eye, and they put something over it and they press down and you go blind a little bit, but that didn't make me fearful at all. But they also, everything that they're working on is almost like a tube. You only see out of one eye and you only see what's coming towards you this way, and the depth of perception is gone because you only have the one eye that's working, and nothing comes fast or anything like that from the side, so you don't have any need to move. When they were doing the cutting, I just saw something sweeping around my eye. I didn't feel anything. The only thing that I felt was the nudging. So if you had something like an eyelash in your eye and you're trying to get it out, or you're putting a contact in and you kind of nudge your eye and you feel the pressure of that, that's the only thing I felt. Not at all. I wouldn't have done it. Nobody could have paid me to do it. You couldn't have convinced me to do it. You probably would have had to give me Xanax for a week. You probably would have had to give it to me before we got in the car. You probably would have had to lie to me and I wouldn't have been prepared at all. There's no way. There's no way at all that I personally would have done it whatsoever, because that was crazy, scary, freaky, disgusting, all the words, all the things. I'm not gonna do it. Only if my vision gets worse and I need to, and worse is in something that needs to be fixed. Being that I've done it now, and now that I've seen it and I've been through it, I feel completely confident, comfortable. I would go in, no questions asked. I'd probably still be a brat because that's who I am, but I would feel very comfortable going back to the same exact place and having everything done all over. Being that I was on Xanax and I don't really know, I would assume it was some minutes, like 7 minutes, 8 minutes, something like that. It wasn't very long. The wiping and motions like that seemed like it was only a couple of minutes per eye, but I honestly don't know. As long as I go to my annual visits, I can have any touch-ups needed at the Envision Center. That way I won't have to wear any glasses and they can completely correct it. It'll just be the reading glasses from there. It was only 3 days. I took the first day off when my eyes were dilated, only because I work in an office and everything is computer based and the light would have been so wretched it wouldn't have been comfortable at all. So I took that day off. The actual surgery, I took the day off, and then the following day I took off only because, again, I work on a computer most of my day and I wanted to have as much rest as possible. So scheduled the surgery on a Thursday and then took Friday off, and then I had the weekend to recover and I was back to work on Monday with no problems. Yeah, for the first day you don't want to do pretty much anything. You just want to sleep. After that, you could do like light exercising, as long as you don't get any sweat in your eyes. When you shower, don't let water go into your eyes. Tilt your head back, or keep this covered so nothing goes rushing into your eyes. Your eyes will dry out. Even I think after 3 or 4 days I got water in my eye and it felt really uncomfortable, so I had to ask for Joshua to come in and bring me my drops because they felt really dry. After 7 days you can do your exercising, you can wear makeup, you can go swimming, only in a hot tub or a pool, not in the ocean. As long as you're outside, like if you're riding a bike or a motorcycle, you gotta wear goggles and protect your eyes. You can do sports and things like that after 14 days. As long as your eyes are protected and covered. You can go swimming in the ocean after 2 weeks. After a month you can go scuba diving and kayaking, snorkeling and diving and normal things that you would do. After 3 months you can do water skiing and windsurfing and skydiving, but everything that they say for the first 3 to 6 months you want to do with as much eye protection as you can. So you want to make sure that extreme winds and extreme water isn't going into your eyes. I think it was just under $5,000. It's going to be $200 a month for 2 years with no interest. We used a Care credit card and got approved for the full price to go under that, so we don't have any interest as long as we make payments. And it's just under $200 a month, so not that much. Yes, my biggest suggestion is you can't rule yourself out. That's something the doctor would have to do, so see your regular optometrist. Go in for a referral and get seen by the actual laser center and then see what they say. So you want to see if 1, it's affordable, and 2, if you have the right type of eyes to do it. I don't miss them one bit, not at all, not one single bit. Sunglasses are easier to maintain because I just put them on in the car or just put them on outside and then put them away. Even cleaning them seems to be a little bit easier, but not at all. I don't get the pain in the back of my head, not on the bridge of my nose. It doesn't annoy me. I can lay down and not squish my glasses.
Thanks for answering those questions for everybody.
You're welcome.
You're not gonna leave, are you?
No. Are you gonna ask them to leave me comments or questions down below?
So that's it for this week. I hope you enjoyed this video. I hope you found it informative. If you did, be sure to like, comment, and subscribe as I release new videos every week. And until next time, keep being awesome.
Whoa! Wake up, party people! It's 7 a.m. and that means it's time for Boner in the Morning. I'm your host, Jonathan Boner. You know what that sound means? It's time for our Top 40 Fart Down, where we count down the same top 40 classic rock songs we've been counting down for the last 40 years.